Pull up a chair and get comfortable. It's time to talk about your federal benefits. Federal Employee Benefit Coordinators presents the FEBC Podcast with Elizabeth Inman and Bryan Fentress.
Welcome, welcome. Glad you're back here at the podcast with me. We are getting ready to talk about postal reform. I know, I can hear you now. What does postal reform have to do with me? I don't work at the post office. It has a lot to do with you. Wait and see. I'm Elizabeth Inman, and I'm the owner of Federal Employee Benefit Coordinators. And my job is to keep you informed on current events. And right now, we're smack dab in the middle of postal reform. And yes, as federal employees, you better be watching. Open season's right around the corner, and the platform they're using now to sign up postal employees into the brand new Postal Service Health Benefit Plan will be the platform that they intend to use for federal employees for your Federal Employee Health Benefit Program. So y'all just ought to be watching, just kind of look over your shoulder and see what's going on with the post office with this postal reform, because it's going to be in your backyard soon. So what I want to do today on this podcast is I'm just going to kind of do an overview. We are in the middle of Postal Service reform, changing over from Federal Employee Health Benefit Program plans into the brand new Postal Service Health Benefit Plans. There are some regulations that surrounds this. I want to do an overview of that. But if you want the details, the nitty-gritty details about Postal Service and the new Postal Service Health Benefit Plan, go back to season 3, because I did a long drawn out detail by detail narrative on what the new postal reform is doing to the Postal Service Health Benefit Plan. Okay? But today, let's talk about you're an employee working for the Postal Service, and we're in the middle of postal reform changing your new health plan. Well, the first thing that's happening is that right now there is a special enrollment program that's for the retirees, but we're in the middle of it now. It started April, it will end September the 30th. But as an employee, obviously, you don't need to know that information. What you do need to know is that they passed the law, they made the change that's going to switch you from a Federal Employee Health Benefit Program plan into a new Postal Service Health Benefit Plan. The other thing you need to know is that we went from over 270 plans to choose from in 2023 to this open season in 2024, you'll have 32 available. Let that sink in. 32. And of the 32, there's roughly a dozen or so of those that are regional, which means most of those are probably not available to you where you live. Yeah. Now, good news. Want some good news with that? Good news is the major players in health insurance for postal employees are still in the game. So Blue Cross Blue Shield, APW, GEHA, Aetna, those big ones are still available for you. Thank goodness for that, right? But I'm just telling you, read between the lines. We went from over 270 down to 32. Okay, moving on. Now, I want to use my notes because I'm going to get to some real technical details about this big change that's taken place. So I'm going to read to you just a little bit. I know that's boring, but it's important. This is very important, as a matter of fact. So if you're an active employee, age 64 or older, as of January 1st, 2025, yep, that's next January, you are not required to enroll in Medicare Part B to continue your Postal Service Health Benefit insurance coverage once you retire. That's a biggie. That's the number one biggest question I get asked about postal reform. Do I have to sign up for Medicare Part B? And it's an if question. So if as of January 1, 2025, you're 64 or older, you do not have to sign up for Medicare Part B. So that's good news. So now find out where I'm at. However, upon your retirement with entitlement to Medicare Part A, which is typically at age 65, you'll have the option to enroll in Medicare Part B during a special enrollment period, which is what we're in the middle of. Right now, we're in the middle of a special enrollment period. But you will also have a special enrollment period that is just for you surrounding your birthday if you work past age 65. Okay, so if you're an active employee under the age of 64 as of January 1st, 2025, to continue your Postal Service health benefit coverage in retirement, you will be required to enroll in Medicare Part B after you retire and you become eligible for Medicare Part A, typically at age 65. So if you're the primary Postal Service health benefit enrollee, your covered family members will also be required to enroll in Medicare Part B once you retire as well. And you have to do that in order to keep your Postal Service health benefit plans. That's very, very important. Now let's just talk briefly about what is Medicare, because we as federal retirees, as postal retirees, as postal employees, we've lived in this little bubble, this nice little cocoon of safety, not really learning very much about Medicare because, quite frankly, we had the best medical coverage out there, and none of us took the time to really educate ourselves on what those different elements of Medicare are. So I just rattled off Medicare A, Medicare B. What is Medicare A? Medicare A is hospital coverage. So it covers if you're in a hospital. There are copays and deductibles with Medicare A, and it's per event. So it's not like normal insurance that, oh, I've met my yearly deductible, I don't have any more. Oh, I only had to pay copay on my first visit. It doesn't work that way. Not Medicare A, not Medicare B. What is Medicare Part B? Medicare Part B is for medical doctors, medical services, and once again, they have copays and deductibles. Now, before postal reform, most of us retired with our Federal Employee Health Benefit Plan. We turned 65, we're retired. Medicare A and B became primary, which is, by the way, the original Medicare, Medicare A and B. It was primary, and our Postal Service Federal Employee Health Benefit Plan became the secondary plan. The same thing will happen now, with the exception that with the conditions that I've already stated, you may be required to enroll in Medicare Part B, or you cannot keep your Postal Service health benefit plan. That's extremely important. That is not a mistake you can make. You want to talk about costly errors in retirement. This could be one of the most costly, because if you don't sign up for Medicare B when you're eligible, there's a 10% per year penalty for every year that you didn't enroll, and that's lifetime penalties. They'll never go away. So Medicare Part C is the Medicare Advantage plans, and then Medicare D is the prescription drug plans. That's just a brief overview of what Medicare is. How it works with your federal plans is the million-dollar question, and it's exactly why you need to pick up the phone right now. Call my office, 918-396-5171. Bryan and Kadri are on standby, ready to take your phone call to discuss your particular situation when it comes to postal reform, Postal Service health benefits, Medicare, Medicare A, Medicare B. Is a Medicare Advantage zero premium the best thing for you? Is it not? Do I suspend my Postal Service health benefit plan? Do I not? And what about that Part D plan? Just call us, 918-396-5171. You're not alone in this.